If you've skipped a prenatal appointment, or you're thinking about it, and you feel completely fine, I get it. But here's the thing. Prenatal visits aren't about how you feel. They're about what nobody can see. So let's talk about what's actually happening at those visits that you genuinely cannot replicate at home. Reason 1. The scariest complications give you zero warning. Preeclampsia, when blood pressure rises to a level that needs managing during pregnancy, affects around 5 to 8% of pregnancies. In its early stages, no headache, no warning, nothing you'd notice on your own. Gestational diabetes, which affects up to 10% of people, is the same story. Fetal growth restriction, where a baby isn't growing at quite the pace they should be, affects about 1 in 10 pregnancies. All 3 of these are quiet. You genuinely cannot feel them happening. The absence of symptoms isn't proof everything is fine, it's just the absence of a signal. Reason 2. Each visit is checking the specific things you can't check yourself. Your blood pressure gets measured every single time, and that number can creep upward while you feel completely normal. Your urine gets checked for protein, which is one of the earliest signs that blood pressure is quietly putting strain on your body. Your bump gets measured to track your baby's growth. If that number stalls between visits, it's a gentle early signal worth looking into. And around 24 to 28 weeks, there's the glucose screening for gestational diabetes. Most people who have it feel absolutely nothing unusual. It only shows up if someone is actually looking for it. Reason 3. The schedule is designed around the stretch where things shift fastest. After 28 weeks, appointments move to every 2 weeks, then every week toward the end. That's not a coincidence. That's the window of pregnancy when things can change quickly, and the visits are timed to match. Each one is placed where it's actually worth checking. Reason 4. Your provider starts to know you're normal. Your midwife or OB builds a picture of you over time. They notice if your ankles are more swollen than last time, or if your mood has quietly shifted. That kind of context takes appointments to build, and it genuinely matters in ways that a single visit can't replicate. Reason 5. Prenatal visits are also for you, not just the baby. Every appointment is a chance to raise the thing you've been sitting with, the worry, the symptom you weren't sure was worth mentioning. Your provider can't help with what they don't know about, and that conversation can only happen if you're in the room. If you've missed some appointments, the move is simple. Contact your provider, tell them where you're at, and ask to come back in. No judgment on the other side of that call. They want you there. If something feels off before your next scheduled visit, heavy bleeding, severe abdominal pain, sudden swelling in your face or hands, a bad headache, or your baby going quieter than usual, those are the ones where you call or head in right away. So if you're overdue for an appointment, pick up your phone today, not tomorrow, today. That one call is genuinely the most useful thing you can do for you and your baby right now. And your baby, for the record, has absolutely zero interest in your scheduling conflicts, which, honestly, fair enough. If this helped, hit subscribe and I'll catch you in the next one.